A 3-year-old female has presented multiple times over the past year with episodes characterized by wheezing and difficulty breathing, especially after colds. Her mother reports that the child had difficulty breathing as a baby, but seemed to improve until last winter. Clinical examination shows slight wheezing during rest, worsening with exertion. Family history reveals the mother has asthma and was a smoker during pregnancy. Considering her age and symptoms, what is the most likely characterization of her wheezing? A. Transient early wheezing. B. Persistent wheezing likely evolving to asthma. C. Unrelated to respiratory conditions, possibly behavioral. D. Symptoms of a rare pediatric lung disease. This child's wheezing episodes, particularly their persistence and familial link to asthma, align with the description of children who are likely to develop clinical asthma. Young children like her, who present with wheezing influenced by the mother's history of asthma and smoking, often belong to a subgroup where these symptoms persist beyond early childhood. The presence of wheezing in early illnesses, severity, and persistence of symptoms along with an atopic background significantly increase the likelihood of progression to chronic asthma, as indicated by familial and early symptom patterns discussed. Understanding the nuances of pediatric respiratory symptoms is crucial for early and accurate diagnosis. Subscribe for more pediatric case reviews to enhance your learning and stay informed about managing similar cases effectively. See you next time.